Hi, my name is Amber Fair. I came today to talk to you about what it's been like to be a medical technologist during the COVID-19 pandemic. We went from seeing in January of 2020 about 3,300 positives a day in Arkansas. As of today, there's 188 cases positive and 3 deaths compared to 33 deaths back then. The biggest difference that we've seen in the hospitals is the number of positive COVID swabs that we've run. We went from averaging about 60 to 70 COVID swabs a day. At one point, half of those or more were positive. Now, more like maybe 5 a day came back positive. Our whole ICU unit in January of 2020 was full of COVID patients. And our cardiac floor, which was the 3rd floor of the hospital, had to be moved to 5 West so that whole unit could be used for COVID patients as well. That has reverted back and everything has went back to normal now. We are seeing far less greater than 4 D-dimers because anyone that's worked in the field knows that it is a blood clotting disease. And when we first started seeing our COVID patients come in the ERs, all of them had positive D-dimer results. We also have seen that there's a wide range of symptoms with COVID-19. So many come in with heart palpitations, to respiratory symptoms, to GI symptoms. And our ERs are starting to look more normal with our regular cardiac patients and things these days than they have been in a long time. The biggest difference, I guess, that I have seen is that we can finally seem to get on top of the COVID patients that we have and give them better care. Where at one time, almost every COVID patient in-house, their hemoglobin levels could not stay up and their oxygen carrying capability was down because COVID affects your red blood cells. So they were all needing to have blood bank done on them because they were giving them fresh RBCs to get their oxygen levels up. These days, we don't have to have as much blood supply since we don't have as much COVID patients in-house. More research has came out, of course, too, which is helping with the amount of deaths that happen for the COVID patients that we do have. Other than that, with the new vaccinations, it seems like there is definitely with the elderly population far less. The people that we do see positive now seem to be from the ages of 16 to 39, maybe 45. So the age ranges have changed on the COVID-19 patients that we do have. And we're just hoping that with the continued vaccination and if people continue to use their precautions, which we're afraid might not happen with them lifting restrictions, that we will not see another wave like India is having right now with a mass inundation, travel restrictions, and people dying because there's just not enough medical care available for them. So have a good day. We'll see what it's like next year. Thank you.